The other factor we really have to be concerned about from a live standpoint or hanging on the rail on these market cows is looking at health-related issues, particularly those that might lead to condemnation of the carcass. Anything that would be a suspect, in particular eye problems in cows, would lead to some issues that the inspectors would certainly take a very close look at. Those cattle just need to be marketed earlier in their production life than waiting until the eye is more involved. So those health-related blemishes, whether it be eye problems, obvious health problems, hardware issues, whatever suspect we might have as far as health, that's a big determination of the value of that cow to the producer. So the quicker we can move them to town, the better off we are. The third thing is probably lameness issues. As those cattle get lame, a lame animal is not necessarily worth less money. It depends on the severity of it to some extent. But the problem is those cattle drop in production so quick and lose condition and muscle mass so quick because of the lameness that we have to market those cattle earlier than we routinely do on a lot of operations. Whether it be beef cattle or dairy cattle, the lameness issue is one we need to market sooner. A lot of the issues around that come back to whether or not we've treated that animal and we expect it to improve in mobility. So one of the first decisions you have to make there is whether or not that cow will respond to therapy, and if she will, how quickly will she do it. So that's something we'll look at a little closer, is making that management decision and whether or not to treat or go ahead and market. Oftentimes we treat in hopes they'll get better. We need to know they're going to get better before we start a treatment regime.